Okay, we're doing that again. Hang on. Welcome back, everybody, to another edition of TalkingWithHeroes.com talk show program. I am Bob Calvert, your host on www.talkingwithheroes.com, our online news site. Thank you for your service.us. I am again behind the camera, and we're still here at FOB Lion in Panjshir Province in Afghanistan. And next, it's an honor to talk with an 18-year veteran of the United States Air Force. Welcome to Talking with Heroes, sir. If you could introduce yourself with your rank and tell us a little bit about yourself and where you're from.
Thank you. I'm Captain Michael Calnicean. I'm originally from St. Clair Shores, Michigan, and I'm currently stationed at Wright Patterson Air Force Base in Dayton, Ohio. I'm a physician assistant at the primary care clinic there at the hospital, and I've been at Wright Patterson for approximately 2 years.
Okay, and when I had a medical question, I was told, talk to the doc.
Absolutely.
So you are the doc here, too.
I'm the doc on the FOB, yes, sir.
Okay. Now, you said you've been in the military for 18 years in the Air Force.
Yes.
Is this your first deployment?
This is my first deployment, yes, sir.
Okay. And where are you from again?
St. Clair Shores, Michigan, right outside the Detroit area.
Okay, great. Why don't you share a little bit about what you do here at FOB Lion?
Well, essentially, my primary job is medical care for all the personnel that are here at the FOB. So I take care of our active duty people, the civilian, and a lot of the local nationals as well that are stationed here at the FOB. That's because it's such a small FOB and there's not a lot of personnel. That's most part a small part of the job. The bigger part is helping mentoring the Afghan Director of Public Health, Dr. Kareem, and his staff. They have approximately 24 clinics here within the province, the DOPH does, and then there are some NGO clinics as well. So what I do is we'll do a lot of clinic assessments, go out and do clinic visits, try and help the clinics as far as doing some capacity building, try and get them out of their rented mud huts into larger facilities so they can take care of the people a little bit better. Also trying to help them work with budgets, work with training, sustainability issues. A big program that I'm working right now is called Strong Women, Strong Foods. And it is a CERT project. It started out initially in the province at 2 facilities. And we're helping severely malnourished children as well as postpartum women. And what it does is strong food helps them get back to their appetite and helps them kind of build out of the severe malnutrition and start to eat and start to gain weight and get out of that rough area. Critical. We have about 7 to 8% of the population in Afghanistan is severely malnourished, so we're trying to help those people in severe poverty. What this program is going to be doing is expanding to all the DOPH facilities. So instead of just 2, it's going to be in all 17 DOPH facilities within the province.
What does that mean?
So instead of just 2 specific areas in this large province of almost 300,000 people, you know, you're only serving a population with the initial program, perhaps a population base of about 20,000. But now we're going to be able to go throughout the entire province and help all the severely malnourished out throughout Panjshir with this program. The other great thing about this is at each facility we're going to be hiring 3 women. So these 3 women are going to be administering the Strong Foods program, measuring, mixing, and giving it to the patients. So we're going to be taking young women and employing / training them into hopefully a future healthcare field. Trying to kind of get them interested in this and hopefully maybe kind of fulfill some really important critical fields right now for women. Midwives, nurses, and hopefully maybe even some of them will want to become physicians with this very basic training that we can kind of expand on. is one of the things that we hope to do with it.
Did you come up with this whole plan, or do you have a team of people?
Strong Food was here before I got here,
Okay.
and actually it was designed by one of my classmates from PA school and a doctor about 4 years ago here within Afghanistan. But it was here in the province when we got here, and we tried to expand this program to allow it to serve the entire province, because there's a lot of underserved areas, as well as trying to help out women, employing women, training women for hopefully future healthcare fields.
So you had mentioned Dr. Did you say Dr. Kareem?
Dr. Greene, yes, sir.
Okay, so this is it's a project you're working very much closely with the people here.
Yes.
The medical establishment.
I have a lot of meetings with Dr. Kareem and his staff, and usually anywhere from 4 to 5 times a month we usually will be meeting with him, discussing medical issues. But this program is specifically, we sit down with him, we sit down with the chief nutritionist, Dr. Maroof, as well, trying to kind of design this program, trying to design it so they can take it over once we leave here. So they can kind of sustain the program and take care of the program on their own. We can kind of help them out initially, and then hopefully malnutrition will lower, the rates will become less, and then Afghanistan can kind of take care of the situation on their own.
It's empowering them too. So
Yes, sir.
when you leave, or the program, people from America leave, the program continues on.
Absolutely.
Teach how to teach. I've been hearing that a lot here. I've heard that a lot in Iraq too. It's very encouraging. Okay. Do you get help from back home? Is there anything people back home could do? Maybe other doctors or medical facilities? Is there any way they can, maybe supplies or equipment or?
There's a lot of NGOs that are actually helping out the DOPH. These NGOs, they get funding, from the World Bank, from different organizations to help out with the budgets that they have, because there's a lot of shortfalls. Afghanistan is basically building their healthcare system from the ground up since after 9/11. The Taliban pretty much did a number to what was here in existence as far as the healthcare system. So it's starting kind of building it up from the base, if you will.
Okay, sounds great. Well, I'm excited to hear about it a lot. How does what is your experience here on this deployment as far as care packages and letters from back home?
It's been great. My family has helped me out a bunch. They've sent a lot of great packages with a lot of treats for the team, myself, useful items. They've been really kind of responsive and been good to, keeping the coffee going, because they don't have Dunkin Donuts dark over here,
Right,
so
exactly.
that's a good one to have here.
Or Starbucks. You said teams. Do you have other people in the medical profession back in the States that work with you, or?
Well, no, I'm talking about the team here.
Okay.
But yeah, I've gotten care package from my clinic that I work at.
Okay. Great.
Friends, family, absolutely.
Okay. Is there anything you'd like to say to the American people that are watching this, as far as continuing to support the men and women who are here? And obviously there's going to be people replacing you and the team that's here right now.
Right. Well, I definitely appreciate everyone with the wonderful gifts that they've sent here, and I appreciate the support that I've had from my friends and family. And I definitely, you see it kind of in the airports when you're traveling. In uniform, and you know that there's a lot of people out there that support you, and it's much appreciated.
So are you active duty Army or National Guard?
No, I'm active duty Air Force.
I'm sorry, Air Force. I'm sorry. Were you in? Okay, not Guard or anything.
No, sir.
Okay. I was just curious.
That's okay.
Okay. You mentioned family. Would you like to give a shout out to family and friends back home?
I'd like to give a great big shout out to my immediate family, the ones who are my wife Karen, and my daughter Francesca,